Hello, everyone. Welcome. This is Healthy Living right here on Independent Television. I am Nuoluwakpo Stevens here in Edo State, Nigeria. The fifth day in the month of May 2025 actually is an important day as it is tagged the World Hand Hygiene Day 2025. Now, what is the whole essence of this day? Why should it be celebrated? What are some of the main objectives? That's going to be our focal point on the show this afternoon. And of course, I am not going to be doing this alone as I need experts to help me break things down even further. So joining me virtually this afternoon, I have Dr. Oluwa Joshua. He is the Assistant Secretary General, Association of Resident Doctors under Edo State Government Employment. He joins me virtually here in Edo State. Thank you so much for coming on board, Doctor. How are you today?
Yeah, I'm doing very fine. Good afternoon. It's good to be here on the show. Good afternoon.
Absolutely. And hopefully we also get to have Dr. Festus Ade Tonwa, the lead infection prevention and control, IPC Ogun State Ministry of Health during the course of the show. So let's talk hygiene for a second. Now, the World Hand Hygiene Day 2025 celebrated today. That's May 5th every single year. Well, this year's theme is tagged "It Might Be Gloves." Quite interesting if you ask me. Now, it's always hand hygiene. So the theme highlights the importance of hand hygiene practice in healthcare settings, emphasizing that gloves are not a substitute for clean hands. So basically, the fact that you wear gloves doesn't mean you're free from diseases or infections. Well, we'll find out from Dr. Ore Oluwa right now. So let's take it away already, Dr. Ore. So tell me, how important is this day for a lot of persons, especially for the healthcare professionals?
All right. So today is a very important day. It's talking about hand hygiene. Today is World Hand Hygiene Day. And it's a reminder to everyone, healthcare practitioners, and the larger population that hand hygiene is very important. It helps majorly in the prevention of diseases. Okay, so it's a day that should serve as a reminder to everyone to adhere to strict hand hygiene practices, which I'm sure we'll talk about during the course of our conversation this afternoon. So, largely for prevention of diseases, staying healthy, hand hygiene is one of the things that we should pay very key attention to.
Now, speaking about this year's theme of the World Hand Hygiene Day 2025, is quite peculiar, if you ask me, as it says
Yeah.
it might be gloves, it's always hand hygiene, and it went on ahead to say that gloves are really no substitute for clean hands. Can you take us through that? What does that really mean, especially for
Yeah.
healthcare practitioners?
Okay. So this year's theme says it might be glove, but it's always hand hygiene. Okay. So the attention here is directed at healthcare professionals who uses gloves or any other professional who works with hand gloves. Now you see, there is a tendency to believe that once you have used hand gloves, then you have practiced hand hygiene, or that hand gloves is um, kind of solve the problem of reducing the burden of transmitting infection from place to place or from another person to another person. So what the World Health Organization is trying to tell us is that it might be glove. That means in some cases, glove does some good in protecting us, preventing disease transmission. But you see, it is always hand hygiene in the sense that washing of hands or other hand hygiene practices is the key in preventing diseases and staying healthy. So it's as much as recognizing the place of hand gloves, using hand gloves to protect uh, the health worker as well as the patient, because when you're working and working with gloves, or you need gloves to prevent yourself from harmful toxins, microorganisms, and also when you're attending to another patient, so you don't transmit microorganisms to another patient. As much as glove does some good with that, but we should not limit hand hygiene to the use of glove alone. Instead, the hand washing is a very, very important aspect of hand hygiene. So that's the summary of what the team is about. I know it's peculiar, but I hope I've been able to try to break it down for every one of us to understand.
Right. Now, let's move over and talk about something else, right? But just before we do that, I'd love you to lay emphasis on the role hand gloves actually play in all of this. And another major question would be, what are some of those diseases, some of those infections perhaps that one can actually get due to a dirty hand hygiene, if I would say?
Hand
Dr.
gloves
Ore.
within the, can you hear me?
Yes, please
Yes,
go
we
ahead.
use hand gloves within the hospital setting when we are attending to patients who maybe a patient, you're suspecting a patient to have certain disease infection, or you are doing sampling, you want to collect blood samples or any kind of sample from a patient, you need to put on your gloves. Or you want to examine a patient, you also need to put on your glove, because people come to the hospital with different kinds of ailments. So you would not want to have direct contact with all of these ailments. So examination, checking your patients, checking their bodies, you are gloved. Handling patient samples, blood samples, secretion, sputum samples, you also need to be gloved. Then when you want to do surgeries, doing also, of course, you have to be gloved because you are directly interfacing with the blood of a patient. Then um, when you want to carry out some other procedures, there are certain procedures that you want to do, and you also have to be gloved. So that's the about the common things that we use glove for in healthcare setting.
I have my other guest ready at this moment, Dr. Festus Ade Lead Infection Prevention and Control, Ogun State Ministry of Health, joining from Ogun this afternoon. Good afternoon, Dr. Festus. Can you hear me?
Can you hear me too? Good afternoon, our listeners at home.
Right, thank you so much for coming on board. So we've been having this conversation just before you came on board, and it seems to me that this year's or the World Hand Hygiene Day 2025, it's more for medical practitioners than for, other humans per se. Kindly take us through that.
I might want to agree with you to some extent, but maybe I should start from when COVID-19 came on board, and it was a pandemic in the country and everybody was thrown into pandemonium. Let me also use that word. Everybody was thrown into pandemonium, running after skater to ask work to be done. And you want to agree with me? At that level, everybody was asked to be carrying around hand sanitizer to wash their hand and there were instructions that organizations, both private and government settings, to have hand hygiene points. But it's not surprising that since after the COVID-19, everybody has gone back to the status quo. So that suffices to say that might not actually be necessary saying that it has to be restricted to the healthcare worker. But as much as I will also agree, the focus, this is the 17th year WHO has started this campaign about hand hygiene. And every year has its own theme, and the focus is the team focuses on different aspects of healthcare service delivery. And as we see in this year team, is saying whether even if it is gloves, it still talks about what hand hygiene. Like my colleagues, the assistant resident doctor, the lady was saying,
Right.
some people believe that if you are gloved, you don't have to still do hand hygiene. And this team is trying to change that narrative, to change that perspective that hand glove we can never and has never been seen to replace hand hygiene. Even if you are going to do any procedure, before you wear glove, it is expected that you perform hand hygiene. And after you finish procedure, you remove your hand glove, you are still expected to do hand hygiene. And this suffice to say that when you talk of infection prevention and control in healthcare setting and anywhere you find yourself, there is what we call 5 moments of hand hygiene. And everything about hand hygiene that we talks about, it encompasses and it is anchored on these 5 moments of hand hygiene. So, as much as possible, when we're talking about healthcare facility and healthcare workers, all their daily and routine activities boils down around these 5 moments. And when we say moments, it's saying when and where you are expected to do hand hygiene. So for me, maybe I should start from what is hand hygiene itself before we now talk about when and how to do it. Hand
Right.
hygiene simply means the need for you to take care of your hands to make it clean. So, and when you want to say you need to clean your hand, it could be before you eat, after you go to toilet, when you have attended to patients in the facility, in the general setting, in food, the general umbrella, all you are
Dr. Festus.
very settings. It's
Okay.
beyond that. So, are you with me?
Yes,
Are you
please
hearing
go
me?
ahead. Go ahead, please.
Okay. So the 5 moments of hand hygiene now talks about before a healthcare worker touches a patient. Before you touch a patient, you are expected to perform hand hygiene. And before you do any basic procedure to do hand hygiene, the first moment is before you touch any patient. The second moment is before you do any clean or any aseptic procedure on any patient you're expected to do hand hygiene. And after you have been seen to have touched or have any exposure to body fluids on any patient or anywhere you are doing healthcare delivery, you are expected to perform hand hygiene. This is the third one. The fourth one is after touching a patient itself, you are expected to do hand hygiene. While the fifth one, which is the last one, talks about after touching a patient's environment. I will go around each of the 5 moments again. When you get to the ward as a healthcare worker, whether you're a nurse, you're a doctor, or what have you, let's assume maybe it's a ward where we have about 10 patients on the ward or 5 patients, depending, even in the private ward, where you have maybe two. Once before you touch that number one patient, you are expected to do hand cleaning, to clean your hands. And why do you need to do that? It is believed that you are coming from somewhere and possibly your hand might have been contaminated. So you are not expected to bring that contaminated hand to come and touch the patient. And that is also to be able to change the narrative that people always believe that maybe it is only the patient that can infest the healthcare worker. Instances have shown that most of the time, at times, for reasons like this, that things are not done properly, there could be this cross
Now,
contamination.
obviously,
And that
Dr. Festus is really quite a lot, but because of the time frame, I'd love us to move with speed at this point. I know we're having this
okay.
conversation of, can we begin to highlight some of the diseases, infection, as the case may be, that one could actually get due to a dirty hand hygiene?
Yeah, a lot you could actually get a lot of diseases you could actually get with that are good hand hygiene and proper hand hygiene. Number one is Number one is the fecal oral diseases. Like we have people, even a lot tuberculosis, a lot of sorry, I said tuberculosis, a lot of respiratory tract infection. Like during COVID too, one of the ways COVID is being transmitted is when somebody sneezes on a surface and somebody touches the surface. When there's a droplet and you use your hand, once you do that, touch your mouth or touch your nose or whatever, and with that you transmit infection. These are several ways by which to transmit. So, numerous diseases that can be transmitted without proper hand hygiene. The example, this so-called food poisoning or this so-called oral diseases. Somebody has gone to staying to contaminate an environment with a fecal matter. Somebody has not washed the hand correctly, and you come to go and eat it. This could be a source of infection. So there are numerous diseases that will come up with improper hand hygiene in an environment. Thank you.
To Dr. Aure Oluwa, if you're still there, Doctor. So just as Dr. Fester said, there are numerous diseases. Now, in your own view of all of this, what are those other chronic, I would say, diseases that a lot of persons can, get from having a dirty hand hygiene?
All right. So before I attend to that, I just want to give a perspective to it. Sometime in 1840s, 19th century, there was an increase in maternal mortality, that is women dying from infection as at that time. And the death rate was about 18%. So there's this particular scientist that thought that because the healthcare workers were not properly washing their hands, so it's contributing to the death of women. Who
So it seems to
hygiene
be,
protocol.
okay. Right, go
Yeah,
ahead,
he
please.
usually had hygiene protocol. Then we saw the death rate drop from 18% to 2%. So you can check it up. The name of scientist is Ignaz Semmelweis. All right. So we have there are a lot of infection, like my colleague has already mentioned. Cholera is one of the things that's also prevalent, especially here in Nigeria. We have cholera to deal with. We have gastroenteritis, and gastroenteritis usually happens when people cook food with maybe they didn't wash their hand before preparing food, or the hygiene around food preparation. People come down with cholera. Diarrhea is also one thing. Especially we see that if in all age group, but in children, diarrhea is very common in children, and one of the reasons we have seen that being common in children because the caregivers for these children have poor hand hygiene practices. So diarrhea is there. Okay, I'd already mentioned cholera. So these are about the common things that we we see commonly in our healthcare space that we
Okay.
also need to pay attention to,
So,
and hand hygiene help us deal with that.
of course. Now, speaking about little children, it's really quite a workload to be able to control how they get to use their hands, touch their face, touch different surfaces. And it begs the question of, aside the little children, how can we begin to incorporate, good hand hygiene practices in our daily routine moving forward?
Okay, very good. So I'll take us back to the COVID-19 era. And during COVID-19, saying during COVID like it's an era. Wait, during the outbreak of COVID-19, one of the things that we did, Nigerians, was that in every public space, there was a hand washing setup. You go to a public place, the banks, public buildings, the church, you see there is a um, large trunk of water, running water, then there is soap, and everybody is asked to wash their hands. Okay, and that helped a lot. So I think it's something that we now have to imbibe or incorporate in our daily activities. You may not do that at work. The setup might not be present in our place of work or in schools because it was also incorporated in schools. But it's something that we can do at home. When you get home, you wash your hands. When you want to eat, you wash your hands. When for the health worker, when you want to attend to a patient, you wash your hands. And after attending to a patient, you also wash your hands. For children, parents can go the extra mile to wash their hands as soon as they return from school and also teach them that hand washing is one of the things that help you stay free from uh, transmissible transmissible disease or infection. So teach them to wash their hands as well. So I think.
Of
putting
course,
this to
amazing,
yeah.
amazing and beautiful as well. Let me move over to Dr. Festus. So there's this popular, I don't know if it's an African adage that says, dirty doesn't kill an African man really. So in as much as something falls off, maybe your food or food just falls to the ground, you just pick it up, dust it, and voila, you put it in your mouth. How realistic is that really?
Oh, okay. If I get your question right, you mean somebody is about eating and the food gets on the floor, they pick it and just eat it that way? Is that what you're saying?
Right. So there's this
Yeah.
regular adage that a lot of people just say that dirty doesn't kill an African man or an African man. You know, a situation where maybe something falls up, your food falls up, and then the next thing you're picking it from the ground and you're putting it in your mouth and you move on and maybe nothing really happens to you immediately. But how true and untrue is that?
It is those are myths and rumors, and they are very untrue. That must be made very clear and sounds loudly. And because if time permits, or if there is any research that can be done, which I believe several has been done, if you are able to do any to see what we have on ground in terms of organisms and germs that we have all around on the floor, not to even talk of the one we have on our hands. You will agree with me, if anything falls from your hand, in fact, if it is what you can even do away with, you will rather do away with it. But if for any reason you want to pick it up, it has to be well washed and thoroughly washed again. And if possible, you peel whatever the cover up is before you even make do with that. So these are very, very important things. Those are beliefs that the deaths don't kill. Like this Yoruba saying, "You won't break, you won't belly over," things like that are things that are done in the deaths are the things that gets money, but it doesn't apply when you talk of healthcare. So these are ways by which people in the past has affected their immune system. A lot of people immunity are just not there, and it is when they are down, they are being infected with an organism or an infection. They have an infection. You realize that the severity of such infection might not be what is expected.
Okay.
Looking back at what the immunity is like, you get to
Okay.
realize
All
that.
right, Dr. Festus. Now, your final word to, the viewers out there. What would you say to them finally regarding the World Hand Hygiene Day 2025?
Yeah, the final word
In
will
30
remain
seconds.
what I've said.
Okay.
Yeah, the final word will remain what I've said earlier on, which still boils down to the theme, as we have been saying since morning, that it might be gloves, it is always hand hygiene. And
Beautiful.
that is why I'm looking. Yeah, so it
Beautiful.
might
Let
be
me let me
gloves,
also
but
move
it
over
always
to
stay hand hygiene.
okay. Moving over to Dr. Ore Oluwa. You want to say something different, or you're still standing on that one? Final words.
So just for everybody to do. There are steps to hand washing, or there are basic things that we should understand when carrying out hand washing. And number one is that we need to wash our hands under a running water, not a stagnant water. Then preferably use liquid soap, not the bar soap. Yes, because the bar soap, we believe that when somebody with a contaminated hands touch it and another person touch it, you can transmit infection. Then when you're done with washing your hands, you would use a dry handkerchief to close the tap and dry your hands. So it's important for us to also
Okay.
incorporate this into our hand hygiene. Thank you.
Absolutely. Thank you so much, Dr. Ore Oluwa Joshua, Assistant Secretary General, Association of Resident Doctors under Edo State Government Employment. Thank you for your time. And also, I have been speaking to Dr. Festus Adetonwa, the lead Infection Prevention and Control, IPC, Ogun State Ministry of Health. Thank you so much, gentlemen, for being a part of the show today.